at least 25% of the patients in which you would consider to give chemotherapy in that patient population without the test will be safe or will not have chemotherapy because you have the results of Oncotype DX. In Canada, Oncotype DX is used by physicians in about 9 provinces out of 10. There's this one province that is on the verge of having it approved so that it will be available for all Canadian women. It's available in the United States, of course, and many parts of Europe. In Canada, we have universal healthcare system, but the application of this healthcare system, universal healthcare system, varies from one province to another. So, for example, the test could be available in one province and the test could not be available in another province, as I mentioned earlier. So, to solve this issue, the solution varied from one province to another. In Quebec, for example, they ask for a panel of experts. In Ontario, they ask for a development study. In BC, they ask for a prospective study. And in that prospective study, for example, in BC, they surely showed that the physicians were more confident, that the patients were less anxious, that they saved chemotherapy in about 25%, and the decision was modified in 30%, which means that some patients who the physician did not think that the patient would benefit from chemotherapy, in fact, the result of the test showed they were at high risk and they would benefit from chemotherapy. And finally, they showed that in terms of year per quality, they save money by using the test. Because if the patient doesn't have chemotherapy, they save on the cost of chemotherapy, they save on time share, they save on complications of chemotherapy, they save on quality of life of the patient, and the patient can go back to work earlier.